I'm Jill Cochran. I'm a pediatric nurse practitioner and I work at Pocahontas Memorial, but my real job is here at West Virginia School of Osteopathic Medicine. I've been a nurse since 1978, but I've been a nurse practitioner since probably 1991. But I finished my Ph.D. in 2011, and I wanted to do research, mostly because in clinic there were so many problems I felt like I couldn't impact the way I wanted to. I have been working with research and fussy babies probably about 7 years now. Working at the osteopathic school has been a wonderful opportunity to expand my research, to teach, and to grow as a professional and as a researcher in ways that I could have never done it if I didn't have the capacity of the institution. As I worked in academics, I found there was a really happy medium of being able to teach and still practice, because kind of it made you sharp teaching because you still kept your hand on the person. But when you're taking care of the person, it helped you be sharp because you could know what the evidence says and you could do a better job of keeping up with all the clinical practice guidelines. It's really hard to say what I love most because I love it all. I think one of the blessings that you have when you've been fortunate enough to practice as many years as I have, that you get your second and third generation. I started out with adults and some children, and then as I became more focused in straight pediatrics, I started seeing the kids grow up, and I got to be part of their health life and their ups and downs and heartbreaks and happiness. And the coolest thing is they bring their babies back, and when they do, I don't even have to ask a medical history. I've lived it with them for the most part. I think it's really important to kind of have the connection. In rural West Virginia, we don't always have what everyone else has in healthcare. But when you make that commitment and you're rural and you give healthcare to people you know and love, you're theirs and they're yours. Well, to get the induction into the Healthcare Hall of Fame to me was like amazing. I would have never imagined that I would be inducted into that level of healthcare prestige, but it was awesome. It kind of validates everything you've done and challenges you to keep going, bust another barrier down. You know, that's what we're about in rural health.